Hey guys, Dr. J here. Welcome back to episode 8 of Heart to Heart with Dr. J. Well, we've been talking about all things that affect our overall health and how to optimize and improve them. We took a little bit of break last time, off tangent from the regular program that we're trying to accomplish here, and did talk about blood pressure. But now I want to kind of get back into the main avenues that we can work on to optimize our overall health. And tonight's topic is to talk about sleep. So why is sleep important? Well, number one, we spend roughly 1/3 of our life either trying to go to sleep or sleeping. Therefore, if it's something that we're spending 1/3 of our time doing, we should probably spend a little bit more effort learning about it and how to do a better job optimizing it. So in the next video, we're going to talk a lot more about this optimization. But for tonight, we're going to really talk about the science of sleep and how poor sleep could affect your overall health. For starters, we need roughly 7 hours of good quality sleep a night. And I say good quality sleep because things like sleep apnea, restless leg syndrome, and other things that are kind of give you broken nights of sleep are not going to be equivalent to good quality sleep, as if you go to bed and sleep straight through the night. And these poor sleep habits can have a myriad of effects on our overall health. I think most of us are pretty well aware that sleep has an impact on us, particularly our mood and our affect. I'm sure many of you have been tired or irritated after a poor night of sleep. Raise your hand here if you've ever felt that way after just getting a couple hours of sleep. So, when we're sleep deprived, we are more anxious and we are more irritable. As well, we're going to be more prone to depression. This is actually really challenging because people who are depressed and have anxiety also have a hard time following and maintaining a good night of rest. So you have this vicious cycle where you get bad sleep, leads to more anxiety and depression, leads to bad sleep, leads to more anxiety and depression, leads to bad sleep, leads to more anxiety and depression. So trying to break that cycle is really important because it kind of leads you into a downward spiral where things could really go out of control pretty quickly. In terms of the science of that, when we have less sleep, we actually are more emotional in our thinking as opposed to logical, and we tend to be more reactive and more impulsive with our decision making. As well, when we are sleep deprived, we tend to think more negatively about ourselves, and this could influence and impact us on the depression. In terms of stress and anxiety, sleep is actually intertwined with our stress hormones, and it could interact or affect our neuroendocrine responses, which we talked about last time in episode 7, how our neuroendocrine system is involved in our fight or flight response and how we react to stress. This neuroendocrine system is also involved in maintaining a healthy immune system and in regulating our circadian rhythm. This is why many people get sick when they're sleep deprived, and why we often say getting a good night of sleep is important to heal our body, because sleep is when our body actually, it actually helps and supports our body and gives it the ability to detoxify and for cellular repair. In terms of cardiac health, you are at risk for higher blood pressure and 50% risk of increased heart disease if you are sleep deprived. This is likely multifactorial. As we discussed priorly, the effects of stress on the heart, as well as sleep deprivation, increases your risk of diabetes threefold and obesity. So just to kind of recap there, in the last video, we talked about all those negative effects that stress impacts our heart. So we just talked above about how, excuse me, We just talked above about how stress, how poor sleep leads to more stress, and we know that how stress has a negative impact on our heart. So you're getting that dual effect there. You're increasing your risk of diabetes by 3, and you're increasing your risk of obesity, which also has a negative effect on heart. So there's multiple different ways in which poor sleep is affecting our heart health. When we sleep poorly, in terms of the obesity section of it, we have more salt cravings, sugar cravings, and cravings more for starchy foods. When we are sleep deprived, we upregulate our hunger hormone called ghrelin, which makes us want to eat more, and we downregulate our satiety hormone called leptin, which makes us feel full, and that's what we usually need for control of our appetite. So maybe everybody's secret to weight loss is just getting a good night of sleep. As well, if you have less than 5 hours of sleep on average, you have a 50% increased risk of obesity. So that's a pretty significant number right there. And I know we talked in the past about eating well and exercise, but sleep's an often overlooked component of weight loss and obesity and how we can get heart healthy. Other organs that sleep does affect is our brain. You have a 33% increased risk of dementia by having sleep deprivation, and it ages our brains on average by 3 to 5 years. So all these other things we're doing to benefit our heart health that we talked about, reducing stress, eating well, exercising, sleep deprivation is counteracting those. So we don't want to sleep deprive ourselves to get all our activities in. Finally, there is a 36% chance risk of colorectal cancer as well. So just to recap, sleep could affect our mood in terms of depression, anxiety, increase our risk for overall heart disease through mechanisms like obesity, stress, and diabetes, as well as increasing our risk for dementia and colorectal cancer. So I hope it gave you guys a bunch of good reasons to realize why sleep is really important for maintaining a healthy lifestyle. And in our next video, we're going to talk about ways in which we could improve and optimize our overall sleep health. So I'll see you guys next week.